A lot of times when estrogen starts to decline, cortisol starts to go up. Cortisol, being the stress hormone, puts us in like fight or flight state. It increases inflammation. It makes our body more resistant to insulin. It puts us in this lack of homeostasis where things are not great.
Small doses to survive. We would not be alive without
Yes.
cortisol. But as you're alluding to, the problem is when it gets out of balance, when that estrogen starts to become depleted and it becomes a dominant player. Yeah, that's when a lot of different health issues can arise. Totally.
Yeah. Yeah, certainly. There's this delicate balance of hormones with estrogen declining, cortisol going up. As far as symptom wise, we increased weight in the abdominal section. You are more likely to hang on to that like visceral fat in your abdominal section. Our vascular system can start to suffer. Blood vessels get narrow. It impacts how our body will process cholesterol. There's less perfusion of the blood to the tissues. We can see like muscle aches, joint pain.
Welcome to the Forward Think Tank podcast, a place of hope, inspiration, and education around holistic health and healing. I'm your host, Jamie Mazza, a holistic health coach, mental health advocate, and dancer. Join me as I share out-of-the-box conversations with integrative doctors, healers, and exceptional forward-thinking individuals thriving on the other side of their health challenges, as well as stories from my own personal healing journey. Thank you for tuning in. I'm so happy you're here. Hello, friends. Welcome back to the Forward Think Tank. This week is a special treat for me for multiple reasons. I get to have a chat with one of my childhood best friends, Jen McCormick. We've been friends across multiple decades. We've been through every single aspect of life. She is a nurse practitioner. She's incredibly intelligent. She is a wonderful human. She's a mama of 3 boys. She is also somebody who has had a wide variety of clinical experiences, ranging from working in the hospital to now what she's doing today, which is working in women's health, lifestyle medicine, and she works with women going through perimenopause and menopause and hormone replacement therapy. So we dive deep in this episode talking all things perimenopause, hormones, what it means when you're in this phase of your life, signs and symptoms that you can look out for that may indicate that your body's natural hormone rhythm is starting to change. And this is a topic that honestly is something that has been in the back of my mind for the last few years. As I've shared across multiple episodes, I have had issues with periods, hormonal changes, issues with fertility. So this is something that I have experience with in my own body. I know how vulnerable it can feel for women when you have all of these physical changes and symptoms and you're like, what is going on? And you have providers that don't have answers. So Jen, as she explains in this episode, was compelled to get into this path with her own journey after she had her second son. She noticed some of the hormonal shifts she was having postpartum. That led her to try to find a solution for what was going on and try to help herself. And she realized, being a nurse for many years, in her clinical experience, she didn't have things to offer people who were going through something similar. Jen has, a wealth of knowledge. As you'll see, she's really great at providing like tangible tools and tips, but also painting really great analogies for how things are happening in your body, because it is such a complex system. As her and I say, it truly is something that we can talk for hours about. And, there are things that are so nuanced and things that are so different from person to person, but she really paints a great picture. If you enjoy this episode, you want to learn more, Jen is such a great resource. It was really fun for us to sit down together. Please let me know, because we can certainly do a part 2 or even a part 3 if it's warranted. To give you a little bit more about Jen's professional background, with 2 decades of experience in healthcare across diverse specialties such as dermatology, plastics, and more recently, women's health, Jen brings a wealth of knowledge and compassion to her work. She's a native of Rochester. She completed the Family Nurse Practitioner program at the University of Rochester, driven by a passion for empowering women with the information necessary to make informed healthcare choices. Her commitment to wellness and empowerment is evident in every interaction she has. Outside of her professional life, she's a mother of 3 boys, an avid reader, and enjoys weight training at the gym. Now, Jen, like I said, she has been one of my best friends for so long. She's just an incredibly caring individual. She's so smart. This truthfully was her first podcast interview, which I was so shocked, because she's constantly out there doing events and working with patients and continuing to spread her knowledge. I admire her so much in all that she does and all that she has on her plate, including tending to her 3 boys. You'll notice that her youngest, Hunter, ends up joining us a little later in the conversation, which I love. Her kids are absolutely adorable. It just goes to show you that as much as we try to plan, sometimes things happen. I will say that Jen did not skip a beat, and she continued to answer my questions super authentically and very intelligently. Jen, I just want to thank you from the bottom of my heart for doing this episode, for sitting down and talking about a topic that feels so taboo and also feels so confusing. And I really just appreciate all of the light that you've shown on the topic of perimenopause, women's health, hormones, all of those things. I think so many women out there are experiencing a lot of these symptoms and wondering what they can do to help themselves. This is a really, really great way to get a little bit of education around it and learn how to advocate for yourself and what solutions may be in terms of bioidentical hormone replacement therapy. If it's right for you, it's certainly something that may alleviate a lot of the symptoms that you're experiencing. I will include all the ways to get in touch with Jen. She does telehealth visits. Like I said, she is based in Rochester, New York, my hometown, and she is incredible. I think everybody out there who has worked with her over the years truly feels her passion and her empathy, and certainly feels very taken care of in her presence. So Jen, I love you. Thank you again for doing this with me. As always, if you enjoyed this episode, please be sure to share it with somebody, send it to a friend, a sister, a cousin, a colleague, somebody who may be going through that change in their life and they're not really sure how to navigate it or where to turn to or what to do next. This episode is so jam-packed with information that I know so many people are going to learn from. So please give a warm, warm welcome to my bestie, Jen McCormick. Jen, welcome to the Forward Think Tank.
Hello, everyone. Welcome back to the Forward Think Tank. This week is a very unique week. I have had a couple friends on the podcast, but this is one of my best friends since, I don't know, Jen, we were like 12, 13 years old, childhood besties. We've been through so many different things in life together. And today I am so excited to introduce you to her because we are talking about one of the most trending topics, at least for women like us in our 30s, early 40s. We are talking all about perimenopause. So I have here joining me, my bestie, Jen McCormick. She is a nurse practitioner specializing in women's health with a focus on perimenopause and lifestyle medicine. So Jen, welcome to the podcast. I'm so glad to have you here with me today.
Thank you. Thank you so much for having me. I'm so excited to be here. It is such a privilege to get to do this with you and to get to share some of this really important information that I specialize in. And to do it with one of my best friends is incredible. What a dream.
Seriously, I know. When you agreed to come on the podcast, I was like, yes, I cannot wait to dive into this topic because it is something that I feel like is hitting so many of us left and right between social media, things that we're experiencing in life as women. And it gets really confusing. So I would love to dive into that and pick your brain on all of these things. For people who aren't familiar with you and aren't familiar with the work that you do, can you share a little bit more about your background and what got you into this work, focusing on women's health?
Yeah, absolutely. So I'm a board certified family nurse practitioner, and I started my nurse practitioner career in dermatology, medical and cosmetic dermatology. It was, a great learning experience. I loved it. COVID happened. During COVID, I had a newborn, and there were a lot of changes that happened in my life and obviously in everybody's life because it was a worldwide pandemic. But it pushed me to leave the field of dermatology, and I was really thought about what do I want to do next. And I really wanted to get into women's health. I had just had a baby. I was pregnant with my second son. And I was like, this is like such an incredible time in a woman's life. I just want to be a part of it. This is so important. So I transitioned into a women's health position with the intention of doing all things pregnancy and all things postpartum and babies. And when I got into women's health, yes, I liked that. And there was so much education on pregnancy, postpartum, and like that, like phase of life. I also did annual exams and acute care visits. So if you had something acutely going on and you needed cultures or whatever, I would do all that kind of stuff. And I would see women across to the spectrum from teenagers all the way up to sometimes women in their 80s. Being that I'm a family nurse practitioner, there's very broad training. And I took, a semester in women's health, and then a lot of the training was on the job. I had a wonderful preceptor. She was awesome. She taught me a ton. I learned a lot from her, but there really was no formal education on menopause, perimenopause, hormone replacement, any of it. So I would see women coming in like their annual and they'd say, I think I'm in perimenopause. And I would panic because I have nothing to offer these women. Hormones are bad. They cause cancer. Take hormones, you'll get cancer, you'll die. And nobody wanted to prescribe them. Nobody wanted to take them. And there are so many symptoms in perimenopause and in menopause that it felt like these women had so many complaints and I had nothing in my tool belt to help them. So it was at first, I'm a little bit ashamed to say this, not something that I felt passionately about or like cared about or really wanted anything to do with at all because I have nothing to offer you. I can't help. And then I had my second son and I struggled postpartum like a lot, way more. Like my first son, it was a breeze. I didn't even realize I had a baby. Things were easy. It was smooth sailing. And then with my second, it was not quite the same. I was super anxious. I was super stressed. I was not sleeping. I was having like horrible night sweats, which sounds crazy. I always was like, night sweats, like how bad could it really be? Like when I say night sweats, like I was waking up looking like I was in a wet t-shirt contest. My shirt was like saturated. My hair was wet. And I was like, this is horrible. If this is like what is happening in menopause or in perimenopause, and I'm telling people, like, sorry, it's just a phase of life, what a disservice I'm doing. I feel like was a really like pivotal moment for me that really hit home. And so when all of that was like going on within my own body, I went down this like crazy rabbit hole just because I'm so curious. I love to learn. I'm a forever learner, just like you are, Jamie. And I just had to know what is going on. Like, obviously, this is hormonal, but why and how? And some of the things that I came across, I'm talking like I was up at night, like scrolling for like hours and hours and hours when I was up breastfeeding. And then I couldn't fall back asleep because my hormones were so out of whack. I had been doing all this research on my own, and something I came across said postpartum is a preview for what perimenopause is like. And that was it for me. I was like, this is what I'm meant to do. And I just knew. And my curiosity like sparked. And then after that, it was kind of all history.
Great. And that's exactly what I wanted because it paints a picture. One, I think that's such a relatable story that you shared. No, I don't have kids yet, but I've also like experienced the night sweats. I've had issues with my cycle, like definitely had a lot of hormonal issues, as you know, like you probably know my story more than some other people out there, but there's so many women walking around, especially postpartum, feeling probably a little bit crazy because they go to the doctor and they kind of just get a little dismissed. And maybe to your point, it's because there is not education provided to providers to say, this is what you can do to help your patients. So good on you. I know like your brain is like a sponge and you've always been such a learner. And thank you for just like throwing that back at me too. I think we're both always trying to help ourselves and then use that to help someone else. So the fact that you saw that as an opportunity to say, why not me? Let me learn about this and then let me figure out how I can better serve my patients. What a blessing, because I am sure so many people walk through your doors like, oh my God, somebody can actually help me relieve these symptoms. So for people who may not have a full understanding, and honestly, I was just having a conversation with one of my friends a couple of days ago, telling her about this podcast and what we were talking about. And she's like, oh my God, yeah, like I feel like, should I be concerned about perimenopause, 38 years old? Can you define perimenopause for us and explain how that's different from menopause?
Yes, totally. And this is such a common like misunderstanding just because nobody talks about perimenopause. Nobody talks about menopause. It's kind of like this thing where people think, oh, I'm being put out to pasture. Like, and that is not the case at all. First thing I want to say about that is it's so interesting because humans are the only mammals, and this is crazy to think about. We are the only mammals that live in a post-menopause state. So my dog, if she was not spayed or whatever, once she gets to perimenopause, that kind of signals to her body like it's time to start shutting down. This is the end of the road for us. And in humans, like that's not the case. This is midlife. I'm not 40 yet, but like I feel like my life is just starting to get good. The most important thing to educate on is that menopause itself is one day. So once it has been a full 12 months of no periods, and in the United States, in Caucasian women, this is usually around 51 is like the average age. But once it has been that full 12 months with no cycle at all, that day is menopause. Anything after that day is postmenopause. Anything before that day is perimenopause-ish. So most people will start to notice their hormones, maybe not even notice it, but hormones will start to decline, usually about, this is the kicker, 10 years before your last menstrual period. That's a decade. That's a really long time. I can't like wrap my head around that. A decade of hormones starting to be dysfunctional and not feeling great, and maybe not even knowing that that's what's going on. So, I mean, if we think about the average 51 being average age, sometimes it's earlier, sometimes it's later. That means perimenopause, I mean, really could start as early as your late 30s and can go all the way through your 40s and into your early 50s, essentially. And some people are more sensitive to it. Hormones are a little bit different for everybody, but it can start as early as your late 30s. Should you be worried about it? No, I mean, it's not like this doom and gloom and oh my God, there's nothing we could do. But could it be on your radar? Yeah, certainly. It's on mine for sure.
When we talk about different hormones declining as we get to that point, the first thing that comes to my mind, of course, is estrogen. I think that's what everyone thinks of, but are there other
Mhm.
hormones that are fluctuating during that perimenopausal time as we approach menopause as well? Can you speak to that at all?
Yes, yes, I totally can. I'm so glad you asked. That's such a great question, Jamie. So, yes, we do think of like estrogen as like the main player. And so we think specifically of sex hormones, which is what is most impacted or most directly impacted by menopause: progesterone, estrogen, testosterone. And yes, women do have testosterone. And yes, it does matter for women. But if we think hormones just in general, I mean, our body has over 50, 60 different types of hormones. So really, what is a hormone? It's just a chemical messenger. I think of hormones, and I'm a big analogy person, so you're going to hear a lot of really nerdy analogies, but this is how I learn and how I remember and how I like to teach. But if we think of hormones as little male people, they deliver the mail to the different body systems. And our body is so complex. And there's a skeletal system, there's a muscular system, there's cardiovascular, everything. So, and one hormone affects another. I like to think of it as a spider web. If you take one link of the spider web out, the web will still stand, but it will be different than it was before. The weight will be different, the center will be different. So when people say my hormones are off balance, they're always going to be a little bit off balance because they all directly impact each other. So when we talk about the hormones, I think the first thing that's really important to understand, and Jamie, please feel free to jump in and share any tidbits that you have on this. I think the first thing that is so important is to understand what the hormone's function is, and what its kind of job and main role is, or what things it does. So if we think about a female cycle, and we have our follicular phase, we have our ovulatory phase, we have our luteal phase. Estrogen usually will spike like right before ovulation. If we think about like back to the caveman days, our bodies are really programmed to go out, find a mate, and reproduce. Whether we decide that that's what we want to do in life, whether we're able to or not, that is what our body is like genetically pre-designed to do. So in that phase where estrogen is up, a lot of times we'll feel a little bit more like va va voom, maybe a higher confidence level, maybe higher energy levels. It's going to force us when we're going to be most fertile to go out, put on our red dress, put on our high heels, feel good, and pull in a mate. Progesterone, on the other hand, is really kind of more in this calming, cozy, kind of comfy, relaxed kind of hormone. So they have like two different roles and they do two different things. When we start to have an absence of those hormones, what we start to notice is the opposite of what they're meant to do. And usually what we see most commonly in perimenopause is that the first hormone to start to decline is progesterone. And that's not in most people. Obviously, everyone is a little bit different. Progesterone declining can be sneaky. It can be really subtle. And the symptoms of that can be super subtle. So if we think about what it does, it's a calming hormone. It helps to produce GABA in the brain, which helps us to get a more calm state of mind, a more restorative sleep, more restful. So without that, it becomes a lot more difficult to stay calm and chill. So maybe some anxiety starts to kick up, maybe some irritability, maybe things that your husband was doing before that like never bothered you. You're like, I'm going to kill you if you don't stop doing that. It is so annoying. Or maybe you have less patience with your kids. I mean, I know that is a big thing for me is I'm like, God, they're driving me nuts. And it never used to be that way. So maybe it's just subtle little differences. Another thing that we can see with progesterone is it really helps when it's in adequate levels. It really helps us to fall asleep faster and shut off that kind of racing mind. So you lay down at the end of the night and you're so exhausted, but your brain is a runaway train. I got to do the laundry. I got to make sure that this is prepared for work tomorrow. Did I do this? Did I do that? And your brain is just running without progesterone. And it makes it really hard to fall asleep. It makes it really hard to turn off, and it makes it really hard to like get into like a restful state. And then estrogen. Well, our main character energy here is estrogen for sure. So estrogen does start to decline usually a little bit after progesterone, and estrogen symptoms without it. The first thing and like the most common thing that I hear people say is they say, I just don't feel like myself. And that is like such a vague thing to hear, but I hear it so frequently. I feel like that's like a symptom on its own of just not feeling like yourself. You can't put your finger on what it is exactly. Maybe the confidence that you used to have isn't there. Maybe you're a little bit more irritable. Maybe you are having a midnight wake up, maybe 3 o'clock, 4 o'clock, and you're like, I just cannot get back to sleep. So progesterone helps you fall asleep. Estrogen helps you stay asleep. So estrogen is really driven by follicle stimulating hormone, which is a hormone in our brain that goes down to our ovaries and says, hey, let's get some estrogen going. And our body is kind of like, once we get into perimenopause, it's like, I don't know. Maybe I'll get some estrogen going. Yeah, if I feel like it. And so the ovaries being like really close to our kidneys, this is like so nerdy. So if this is like too much, like please tell me, but
Right.
I just geek out on this stuff.
Right.
I just love it.
Good picture
Ovaries being super.
people who don't have an understanding at all, because this is not something that we outwardly learn about. This is something that truly, unless you're searching for it, you're not going to understand this information. So keep going. This is amazing. We love it.
Okay, good. I love learning about it. I love teaching on it. I just think it's so important. And as women, we should really know and understand, or at least have an idea of what's going on in our bodies, because otherwise we're like, what the hell is happening? I'm losing my mind. And it's like, no, you're not losing your mind. You're losing your hormones, and that's impacting everything. So follicle stimulating hormone is like working really hard to tell the ovaries, hey, let's get some estrogen. Let's get it going. We need some estrogen here. And our ovaries are like, no, not today. And so our kidneys, our adrenal glands are located not that far away from our ovaries, all in our, pelvic cavity.
Mhm.
And our adrenal glands, God bless their heart, they're so helpful, are like, well, we can help. We don't have estrogen, but we do have cortisol. And it kind of looks the same, right? And no, they don't do the same thing at all. So a lot of times when estrogen starts to decline, cortisol starts to go up. And so we get this kind of indirect, one is up, the other one's down, and it's kind of in the opposite ratio of what we want, right? We hear all the time like cortisol is bad. You don't want cortisol. Cortisol, being the stress hormone, puts us in this like fight or flight state. It increases inflammation. It makes it harder for our body to be, or makes it more resistant to insulin. It just kind of puts us in this lack of homeostasis where things are not great. So,
We need it, right?
um,
Small doses to survive. We would not be alive without
yes.
cortisol. And like alluding to, the problem is when it gets out of balance, when that estrogen starts to become a little bit more depleted and it becomes a more prominent, dominant player. Yeah, that's when a lot of different health issues can arise. Totally.
Yeah, certainly. I think there's kind of this delicate balance of hormones with estrogen declining, cortisol going up, and some of the things that we can see as far as symptom wise, we can see increased weight in the abdominal section. That's a really common complaint that I hear is like my pants don't fit anymore. I used to have a butt and now I have a gut. So it's like not necessarily that you will gain weight, but you are more likely to hang on to that like visceral fat in your abdominal section, which is less healthy for us. And obviously nobody feels confident when they're hanging out, with more adipose tissue in their belly where they never used to have it. So when estrogen is higher, we'll see more of like this, Coke bottle shape. And then when it is starting to deplete, we see more of like an apple shape. And all shapes are wonderful, but most women feel more confident in that Coke bottle shape than they do in an apple shape. Other symptoms like that we can see when estrogen starts to decline, if we think about every single body system is affected by estrogen. When estrogen declines, we can see our vascular system can start to suffer a little bit. Our blood vessels get a little bit more narrow. They get a little bit more rigid. It impacts how our body will process cholesterol. Oftentimes we'll see bad cholesterol will go up and good cholesterol will go down. There's less perfusion of the blood to the tissues just because of those vascular changes. So sometimes with that, we can see like muscle aches, joint pain, estrogen receptors in our joints. So stiffness in the joints, or a lot of times I'll hear people complain like that their knees hurt. So that's something else. And then something else I so commonly hear is brain fog. And so people will say, I'll walk into a room and I can't remember what did I come in here for? Or like it just yeah, it's like the worst. Or you'll be in the middle of a presentation with colleagues, or then you literally just can't think of a word. And so our brain is also so wired by estrogen. I like to think of, this is another silly analogy, but I like to think of our brain as like a parking garage, and it has so many parking spots. All of the parking spots are estrogen receptors. And if nobody's parking in the garage, no one's going to continue to maintain the garage, and it's not going to be profitable. You're going to get that brain fog. You're not going to be as sharp or like quick witted as you used to be because it's not being used. And the estrogen receptors are just sitting empty waiting for the estrogen.
Great visual and also a kind of sad visual. I can only imagine the people who are listening to this conversation being like, wow, everything she just said makes so much sense and validates certain things that I have been feeling, or maybe friends or family members have been feeling. So thank you for painting all these pictures, all the analogies, like this level of detail, I think is such an important tool. And hopefully people will really get a lot out of this. It's really great. And I'm glad
Um,
we talked about like some of these signs and symptoms. So keep going if you have more to share because it's really helpful.
Yeah. Okay. So what else? So estrogen also, gosh, there's so much. Estrogen also is so important for maintaining bone density and maintaining bone health. So it's so important for calcium to get reabsorbed in the bones. A lot of times in older women who have not been treated with hormone therapy or, are not great about taking calcium or vitamin D, we can see osteopenia, which can progress to osteoporosis, which it sounds like a fancy word for just saying that our bones are not as strong as they used to be. And you're at a higher risk for breaking a bone. Which,
Yeah.
I mean, someone, Jamie, like you or I'm like, okay, I break my arm, like whatever, or like I break, my femur, unfortunately. Yeah, that would suck. But when you are a little old lady or an older woman and that puts you in the hospital, and then you develop pneumonia while you're in the hospital, and then another complication. Like, so for someone who's young and healthy, it might not feel like that big of a setback. But when you don't have the resilience that we have at this part of our life, it can be a huge setback and it can be a huge kind of like downward spiral. So it's just so important now to do the things that help to prevent that down the road. And so that's another reason why this is so important to me. If we're thinking about life and quality of life and longevity, I want to be that little old lady that's not at a nursing home. And I want to be like the grandma that is carrying my grandkids around. And I want to show up for my kids in ways that I can as long as I'm able to. And we all only have so much time here. So I just want it to be the best quality. And I want that for other people too. I think
Yeah.
the best things in life are shared. I want everyone else to be able to benefit from this information because it's so important.
Yes, it really is. So let's go a step further and say somebody is coming in or somebody's listening to this conversation saying, oh my gosh, okay, I think I need to talk to an expert about perimenopause, whether they are able to see you in person or they go to their provider. What types of tests or diagnostic tools would you use to give us an indication of this is what your hormones look like, this is what's happening in your body, and how would you approach the conversation of hormone replacement therapy? Let's get into that and segue into the hormone replacement therapy piece, if that
Yeah,
wasn't
totally.
too much of a loaded question.
Um, no, that's okay. I realized I didn't talk about testosterone at all either. So if you want me to touch on that, I can too.
It's all good. We can always come back to it. And honestly, maybe if we need to do a part two, we do a part two.
Yeah, I think that I would be. I know I'm like giving you so much information.
So hard to condense all of this into a short 1 hour conversation. But I think this is a really good like initial conversation to paint the picture for people who may be having some of these symptoms and wanting to know what they can do about it.
Yeah, I feel like we could even do like a whole second session on testosterone and sex drive and vaginal dryness and like all of that too. So we can always save that too if we need to, if that's something you're interested in.
No, no, no. This is so
Um,
good. I promise I'm loving
okay,
it.
good. Okay, good. So labs, as far as labs, this is it's a touchy topic because some providers will say there's no lab that will tell you yes, you're in perimenopause and or no, you're not. And what is so tricky about hormones is they fluctuate so much on a day-to-day basis, especially in perimenopause and just the nature of being a woman and having a monthly cycle. There's different ranges for different times of the month. And then in perimenopause, we don't even necessarily follow that cycle. So some people will say, don't even bother getting labs. My thought is that perimenopause can be really vague and it's really a clinical diagnosis. So it's important to me to hear what things you're experiencing. And then I like to get labs to rule out out other things and look at where your hormone levels fall. Knowing that, I can take that as a grain of rice, because if we think about in premenopause, so, when you're having a consistent regular cycle, your hormones are optimal. Our hormones are going to be so predictable. They're going to be so regular, and our body knows what to expect. It knows what's coming. And then when we get into perimenopause, most people will usually still cycle throughout perimenopause. So premenopause looks like synchronized swimmers, right? So everything knows where it's supposed to be, where it's going, what's coming next, very orchestrated, this beautiful harmony. And then we get into perimenopause and it's like a water polo match. There is people going every way. It's chaos. There's splashes. There's water everywhere. There's a ball in the pool, out of the pool. Getting the hormone level in perimenopause can be tricky. I think it's worth getting just because sometimes it is consistently really low. And I do think people like to know, where are my hormones? So I do still always get those. And I think it's worth asking. Some providers may give you pushback and say it's not necessary or it doesn't help, but I like to get it. I like to have that and be able to provide it to people. It's also so important for me to look at ferritin levels, thyroid function, different vitamin levels. All of this impacts, how your hormones function, but also a deficit or dysfunctionality in one of those departments could be impacting other things too. So I do still like to order labs. Not everybody does.
Yeah, very valid point.
Um,
And I think one, just to add a little bit to that conversation, and especially as somebody who has struggled with fertility issues, lots of different hormonal imbalances, struggled with regular periods or irregular periods, which can also start to happen as you enter that perimenopausal phase. To your point, it is hard to take your labs, which are just, something you do on a single day. It's like a snapshot in time of that day, or maybe the last 24 to 48 hours. I'm sure you would agree with this. If you are going to look at labs, it's probably important to look at a trend and do it around the same time of
mhm.
month to see what is happening. Are these things staying stable? Are they starting to increase? Certain things decreasing? It's important to look at labs. And it's also important, to your point, to look at things like vitamin D levels, which are our precursor of a lot of
Mhm.
different hormones, and taking a look at other things that can impact what's going on. So thyroid, I know so many people who have been misdiagnosed. They miss looking at your thyroids. I'm having all these other symptoms. Your thyroid does get impacted by the fluctuation in hormones, but there are often times where a thyroid issue goes misdiagnosed because doctors aren't
Mhm.
looking at that. They're saying everything else looks fine. They're cherry picking what labs they're looking at. I mean, this is a whole separate conversation. There's a lot of different things to take into consideration because we are such fascinating human beings in the way that our body operates. So, but
So complex. No,
yes,
but it's so complex. And like you said, if someone has this honed in tunnel vision of what they already think is wrong, they might not look for other labs or they might not order other labs. And
yes,
really, we could be missing something that could be easily fixed or impacted in a different way. Hang
100%.
on one second. Hunter just woke up. Hold on one second. I have a small friend with me now. So
Hi,
hopefully he'll chill
Hunter.
out. Say hi, Hunter.
Hey, buddy. So if somebody is coming into you experiencing some of these symptoms, you take a look at labs, you get an idea of what's going on. At what point would you recommend hormone replacement therapy? And can you also speak to bioidentical hormone replacement therapy and how that may be different than traditional hormone replacement therapy? Because I think there's a lot of misunderstanding about that. To your point, back in the day
Mhm.
when people would suggest hormone replacement therapy, people would just be like, oh my God, no, I take this, I'm going to get cancer. It's very different. And I think a lot has changed. So can you just shed some light on that area, if you don't mind?
Totally. No. This is going to be a long-winded answer, but so yes, in the late 90s and early 2000s, there was a study called the Women's Health Initiative. And the Women's Health Initiative really was just looking at women using hormone replacement therapy. They weren't testing to see if it caused breast cancer. They were just looking at the long-term effects of it. And it was a big study. There was 4 different groups of the study. And they were looking to study women who are in perimenopause. So if we think about who is in perimenopause, who would benefit the most from hormone replacement therapy, it's usually going to be women in their 40s, maybe early in their 50s. And if we think about women in their 40s and 50s and what their lifestyle is like, we are busy. We are taking care of families, are, working on our careers. We are doing all these different things. Most of the people who were in the study were much older than that because these people, 40s and 50s, women in their 40s and 50s, we don't have time to be a part of a study, getting blood draws every week, doing all these different things that were involved in the study. The study used a group of women who average age, I think, was like 65. So most of these women were like at least 10 years after menopause. The vast majority of women in the study were smokers or already had different comorbidities, whether it was like cardiovascular disease or diabetes or whatever. It was not the healthiest group of women, and they did not have the healthiest lifestyle habits. And within the study, it had gone on for several years. And anytime a study is set, the study has what is called a hazard ratio. Once something happens enough at a certain threshold in the study that is considered to be dangerous, they stop the study. And so one thing I want everyone to think about or put on a critical thinking hat about is when research is done, there is a big difference between something being correlated and something being caused like by another. If we think about the homicide rate, this is like totally like off topic, but I think it will help to like understand the picture. If we think about like the homicide rate in a big city, it goes up in the summer, right? We don't know why. Potentially opportunity. People are outside more. It's hot. Maybe your air conditioner is broken, irritability, just more opportunity. But also what goes up in the summer is ice cream sales. So even though these two separate things, ice cream sales and homicide rate, both go up together, both go up around the same time, it doesn't mean that eating more ice cream causes more homicides, right? So the two things can both increase together, but it doesn't necessarily mean causation. So just keeping that in mind. In the study, there were a few women in the study who developed breast cancer within the time of the 8-year studies. I think there was 3 in the study, and it was a huge study, over 1,000 women in it. But it happened to meet that particular hazard ratio. So because of that, they shut down that group in the study. When they shut down that group in the study, they did this press conference and said, we've been studying this. We found out that hormones cause cancer. And if you take hormones, you're going to get breast cancer and everyone should discontinue their hormones. So people went home and like flushed their hormones down the toilet. Providers stopped prescribing them because they were fearful after the study came out. And like over 90% of people who were prescribed hormones stopped using them. So, and it also started this like kind of fear mongering thing too. So nobody was using hormones. Another thing to keep in mind about the study is the hormones that were being used at that time were synthetic. So when we say a synthetic hormone, it means it looks similar, like on a molecular basis, it looks similar to what our body makes, but it's certainly not the same. Whereas bioidentical, the chemical structure looks exactly the same. And it is metabolized by our body the like exact same way that our body would metabolize our own hormones. With the bioidentical, it's a little bit safer. We're less likely to have side effects. Our body tolerates it a little bit better. Well, a lot better. And people just seem to do much better with it than they would with a synthetic.
I know there's a lot of different types of ways that you can take hormones. You can do it orally, you can do patches, you can do creams. Like, how would you go about advising with the patients that you work with what may be the best for them to try?
Yeah, so I think that's such an individual question. And part of it is dependent on lifestyle factors for sure. I can say that oftentimes what I'll suggest, at least to start with, is using a patch and for estrogen. And estrogen is going to be best absorbed through the skin. It bypasses the first pass of the liver. So with an estrogen patch that is estradiol, which is bioidentical, there's no increased risk of blood clots. There's no increased risk of liver dysfunction or anything like that. And they've actually found that it does help to overall lower your blood pressure. So increase your vascularity and help to relax the blood vessels a little bit. I usually would recommend starting with a patch just because that's like the safest, lowest risk, most readily absorbed for most people. And then as far as progesterone goes, I usually recommend a capsule. And the reason why is just because it can create a little bit of a calming effect that it's usually recommended to take it at night, right before bed, maybe an hour or so before bed, because it does really help with sleep. Certainly you could take it any time of the day that you wanted. And you could use a cream or a patch. It really helps with those symptoms when it's taken orally at night. So I think it depends on the symptoms for sure. And then also lifestyle. If someone is a super sweaty person, or maybe they're a swimmer and they swim every single day, maybe a patch wouldn't be a good fit. I think it really just depends on lifestyle and personal preference.
Yeah, I love that. I mean, listen, you have to make it make sense for that individual person. And there's definitely no one size fits all with anything. So the fact that there are options and you look at what makes most sense for people's lives is awesome.
Yeah, I think, like you said, it's not a one size fits all, and all the options come with different benefits or different risks. And I think just really like getting to know the patient and understand their lifestyle is so important. So it's a tricky question to answer. And sometimes we don't get it right on the first try. Sometimes we'll try a patch and then they come back and like it doesn't stick to my skin, or the patch caused irritation, and let's pivot and we'll try something different. So I hope that people know not to get discouraged because hormone replacement is not a one size fits all. And sometimes it does take a little bit of like dialing in, dialing out, being patient, and trusting in the process a little bit.
Yeah. And to that point, I think it's also important to have an open dialogue and a good relationship with your provider. I mean, I've known you what feels like our entire lives. Basically, it is our entire
Yeah.
lives. And I know like what a nurturing person you are and how much you care. And so to have somebody like you in your corner when you're going through such a transitional period of your life, and it can feel very vulnerable. It can feel very scary. It can feel very uncertain, as you're watching your body go through changes that you're not quite sure how to navigate. So having a great relationship and open dialogue with your provider goes such a long way. And just knowing you and how much you care, um, I have no doubt that you're all around making such a big difference in people's lives by doing this work.
Oh, thank you for saying that. I really do care so much. And I've seen when people have the best results and they feel so much better and they come back and they say, this saved my marriage, or my life is so much better now. I'm thriving and I was not before. And I just think like everyone deserves that opportunity to feel like their best self. And we use that term, my best self, living my best life all the time. We throw it around, but truly everybody deserves to have that opportunity. So I think just having that open dialogue and being able to communicate with your provider is so incredibly important.
Now, just to back up a little bit in terms of hormone replacement therapy, are there certain people who you would consider a good candidate and maybe some people, hi Hunter, who this may not be?
Yeah, I think everything is a risk benefit. I used to work with a physician and he was a little bit blunt, but he would always say, you don't get something for nothing. And what he would mean by that is sometimes things come with side effects, or sometimes there are certain risks to different things. I don't want to say everyone is a candidate for HRT because they're not, but I do think more people than we realize are, and I think it all depends on what benefits you see versus what risks. If you have had like a type of cancer that you know or has been tested to be estrogen receptor positive or progesterone receptor positive, then I probably wouldn't recommend hormone replacement for you, at least not with those types of hormones. If you have had, a history of using a birth control pill and really struggling with it, or just didn't do well with it, maybe we start a little bit slower and kind of build up. The good thing about using a patch or using a pill is that you can stop it at any time. It is short acting, usually will stay in your system. If it's a pill, 24 hours for the most part, and then if it's a patch, usually if you take it off, the levels will start to decrease. So the good
Mhm.
thing is really nothing is permanent about it. So if you start and things are not feeling good, you can stop at any time. You don't sign in blood that you're going to use it for the rest of your life. So I think really the biggest thing is like the estrogen and progesterone positive cancer history.
Very great point. And now it sounds like it doesn't stay in your system so long. So if you choose to go off of it, it leaves your system pretty quickly. But in terms of people starting hormone replacement therapy and noticing results, how quickly on
Mhm.
average, I'm sure again it's different from person to person, how quickly would you say people who do choose to try the bioidentical hormones start to notice improvement in their symptoms?
Yeah, that's a great question. So it does definitely like vary person to person. I would say the most important thing, this sounds very woo woo. This is not like something that I would have ever suggested to anyone before, but I tell everyone to keep a journal because sometimes the improvements are so subtle. Yeah, write down a score for like what is like the biggest, like your top like 5 symptoms. So say, sleep, irritability, no libido. Write a score for each of those 0 to 10. Then the following week, take an inventory, assess the score, and keep an eye on it. I think you can start to notice improvements like as quickly as within, a week, but it can take, a month or more to really get to like the maximum impact that you're going to have. And it varies person to person too. And it varies if we get the dose right on the first try, because sometimes we'll get improvement in some symptoms, but not total relief.
Makes sense. And I think that's also probably being got to be encouraging for people to hear too, that you can test it out, see how you feel. You can also modify the dose to make sure that, you get the right dose for you.
Yeah, absolutely. You dial in, you dial back out. The goal really for me and, for my patients is I want people to feel 80 to 85% their self, but have no side effects. So it's a delicate balance between minimal side effects, but maximum symptom relief. And sometimes we just have to kind of toy with the dosage a little bit to get that.
Yeah. In terms of lifestyle shifts, things outside of the hormone replacement itself that you may recommend to some of your patients to support their body changing in this process, are there anything that you would encourage them to take a closer look at in their life, or maybe make some tweaks while they're also taking hormone replacement therapy to help the transition that's happening in your body at that time?
My gosh, everything, I feel like, you've mentioned sleep is huge. Stress management is huge. Exercise, movement, lifting weights, all of that is so important. So lifestyle can be medicine if you choose to have it be. So I think all of that matters. Every aspect of it, every aspect of that impacts your overall health, your overall wellness, how you feel, how you manage like these changes. I encourage all women to lift weights or do some sort of resistance training 2 to 3 times a week, getting steps in, getting movement in, just moving your body, even if it's, for a shorter period of time. Like maybe you can't commit to a full hour of going on a walk, but you park a little farther away and you get more steps in. Maybe on your lunch break, you can't go the whole time, but you get 10 minutes of walking in. Those things matter. The little habits, they add up and it really, really matters. Sleep, oh my gosh. And sleep is like such a touchy subject, especially in perimenopause, but it impacts everything. If you are not sleeping, you feel like crap. You're irritable, your cortisol's up, you're puffy, you're grouchy. I mean, if you don't get sleep, nothing else is functioning like in its best capacity. So if you're not sleeping, even if you're prioritizing rest, that really matters and really makes a difference. So even just like laying down a little bit earlier so that potentially you could sleep a little bit longer. And even if you're not actually sleeping, you're resting a little bit longer. It all matters. And I'm forgetting one of the basic, most huge things is nutrition. Just eat whole foods, for God's sakes. It makes such a difference. There's so much. And I know you and I could talk about this like all day. We could do a whole nother 24-hour podcast about it. But there are so many things added to our foods that are hormone disruptors and are not good for our bodies. I think just keeping it simple and eating whole foods, like, it doesn't need to be at 100% of the time, but, small changes, like, impacts. Lifestyle is huge and so important.
Yeah,
I know
nailed
I'm
it.
preaching to the choir because I know you, like,
Oh,
shout it from the
absolutely.
rooftops, right?
But you know what? But it's good to hear
Yeah.
from somebody else as well, because I sit here and I talk all the time about how important these things are. I think I've realized in my own journey and also working with clients for so long, you hit the nail on the head. If you're not getting sleep and you're not managing your stress, those two things alone, I mean, food is so important. Don't get me wrong. I'm not negating the nutrition piece. But sleep and stress management to me are the foundation of so many things that affect all the chemical messengers in every single part of our body, down to if you don't sleep and you're stressed out, you're more likely to crave more carbohydrates and more sugary foods. And then that just
Yeah.
kind of sets everything on a perpetuating cycle in the opposite direction of supporting your health. But I love that you look at those things and I love that you recognize how important they are and also encourage people to just like start where you are, not necessarily overwhelm you.
Right.
Parking the car a little further away. I always use that example as well. It can be something really little instead of making it feel like this huge, overwhelming thing when you're already feeling overwhelmed with what's going on in your body. So love that. Love your answer.
Right. Right.
Um,
I mean,
and
yeah,
totally agree.
well, thank you. But yes, I mean, you think like, okay, I'm going to start a new lifestyle and I'm going to, from now on, here on out, I'm only going to eat whole foods. I'm going to exercise, an hour every single day. I'm going to prioritize 9 hours of sleep every day, which by the way, if you didn't know this, women's bodies do actually require more sleep than men. And that's like a science thing. It's a clinically proven fact. Our body needs more sleep, more time to recover. Our hormone cycle is more intense. Our body's working harder to maintain that hormone cycle. Men, their hormone cycle is 24 hours and then it resets and it starts all over again. Ours is much more complex. So we do require more sleep. Setting out to do all of these things and do them all at once and do them all really, really well, I think sets people up for failure. So it is small changes over time, big impact, and attainable goals too.
Yeah. If you could give advice to women in their 30s or maybe early phase that are starting to notice some changes in their body, and are maybe feeling fearful about talking about perimenopause or asking questions, what piece of advice would you give them?
Knowledge is power. The more that you can learn and the more you can understand, the easier it is to advocate for yourself. I think as a traditional healthcare provider, we're like, oh, don't go on the internet, don't Dr. Google. But I do think that we live in a time and a place where there is a lot of information that's readily available to us. Granted, the internet, not everything is reliable, but I do think we have access to a lot of information so we can be educated and we can understand things better. And when you understand something better, you feel more confident to talk about it and you feel more empowered to advocate for yourself. So educate yourself, understand it, seek out opportunities to learn more, connect with other people that are like-minded or in the same like life chapter, because we're all in this together. There's no woman out there who is exempt from menopause. And if you are, it must be nice to be God's favorite. I haven't met her yet, but we're all going to go through this. So, power in numbers. Let's work together. Let's talk about it. It's not this taboo thing. Get out there and connect. And I think that that's really, really powerful on its own um, to help with this time period.
Love that advice. Yeah, I was thinking before you said it and then you said it. And I'm like, of course, we're on the same page. Yeah, talking to people about it, not being afraid. I remember when I started having like some pretty irregular cycles and I was really in my early to like mid 30s and I was like, oh my god, nobody else is going through this at this age. It was like totally isolating, but I was isolating myself by not talking about it. The more we can share, and to your point, there is so much information out there. Sometimes it's overwhelming, but if you take that information and you utilize it to your advantage or bring that up in a discussion with your provider, you're kind of arming yourself a little bit more ammo to be like, okay, I have an understanding. I know that there are things I can do about this. And there's so much power in community and knowing that you're not alone in this phase of life. Really, really
Yeah,
great.
I mean, like I said, we're all in it together. Nobody's exempt. Talk to your sisters, talk to your mom. I mean, I never had a conversation with my mom about it. And when I said to her, what was menopause like for you? And she's like, oh my God, it was awful. And I was like, well, why didn't you ever say anything? I never heard you complain. And she's like, well, I don't know. Nobody talks about it. I'm just getting
Right.
old. And I'm like, yeah, but it's a universal experience. There's so much power in togetherness and validation. Let's talk about it. I mean, we talk about everything else. Why would we not talk about that? Right.
Yeah,
So
totally.
I don't know. And yeah, I think it's just important.
So
Of course.
I have
Yeah.
one final question for you. I ask everybody who comes on the Forward Think Tank, what keeps you moving forward in life?
I would have to say my kids. Well, they need me to keep moving forward because they can't keep moving forward without me. But I think they are just so important to me. They are the loves of my life. My family is so important to me, my friends. I think just the people around me and, knowing that people rely on me and I want to show up as my best self for them. So I think that I would just say the people in my life that I love and that are here for me and I want to be there for them too.
We love you, Jen. You shared so much information. For people who may not know Jen, I'm a woman. I'm always thoroughly impressed with how she keeps everything afloat. She has multiple things going on in her career. She has 3 kids. She's an incredible friend. She is just dedicated to every aspect of her life. And the fact that we had this conversation, you were able to answer these questions so fluidly and paint beautiful pictures for people who are looking to learn more on this topic. I'm always so proud of you, but I'm so grateful that we could have this conversation and that this can be something that people can learn from. So I appreciate you so much. I love you so much. There's so
I
much.
love you so much.
This is
That
really
is
good.
like the nicest thing. Thank you. Thank you for saying all that. I'm really happy and honored, and I feel really proud that you wanted me to be on your podcast. Thank you for having me. It was really, truly my pleasure.
you are the perfect person to bring on and speak to something about like a topic like this that I feel like so many people are just confused by. And the fact that you chose to get into this work from your own personal experience and help people thrive and, like you said, live their best life. It's such important work. I feel really grateful that you were willing to do it.
Well, thank you. I feel honestly like privileged that I'm able to do it. I feel very lucky that, like I said, I didn't seek this out. It kind of fell into my life the way that it did. And I'm very thankful that it did. I feel like it is really, really important work. I actually want to share really quick if anyone is looking for reliable resources, I know there's so much on social media, but two female menopause providers, physicians that I follow, Dr. Heather Hirsch. She's wonderful. She is actually a Rochester native. And then Dr. Mary Claire Haver. They're both evidence-based, up-to-date, current literature. I took one of the Heather Hirsch courses. She's amazing. Those are two really good like resources to start if you're looking for like online reliable
Yeah,
information.
thank you. Yes. And I'll make sure that I get both of their accounts or their sites, and we can link that in the episode notes so that people can have a direct link to learn from them. So thank you for bringing that up. So Jen, thank you again for everything. I will make sure to include links to how to get in touch with you if somebody's interested in setting up a telemedicine visit. We will include links to your Instagram, your website, all of that. If you are, just totally enamored and interested in what Jen is saying, I will make sure that you have every resource possible for how to get in touch with her. She's incredible, and I want to make sure people know how to get in touch with you.
Thank you, Jamie. I appreciate that. Thank you.
That's awesome. Thank you.
Hyperbaric oxygen chambers, or HBOT, has been one of the most supportive tools in my healing journey. Why? Because cancer cells thrive in low oxygen environments, and the delivery of oxygen via these chambers help to arrest these cells in their tracks. Not only that, but these chambers can also be used for recovery from surgery and general health maintenance. The best part? You can test this machine out from the comfort of your own home. When I started working deep in the metabolic approach, I was often so overwhelmed trying to make sure my ketones were high enough and glucose was low enough to enter the chamber and maximize the impact, and instead found myself more stressed than ever going back and forth to the wellness clinics only to find out I wasn't in that sweet spot to take a dive. After doing some research, I discovered an amazing small business called Affordable Hyperbaric Solutions. They're based in Colorado and they provide exactly that. Hyperbaric chambers for an affordable price to rent in the comfort of your own home. This entire team has been so kind, resourceful, and flexible, getting me a chamber in my home that I can use at my own leisure. They even have rent-to-own options if you love it. I love supporting a small business with a big heart. If you are interested in a chamber, check out the episode show notes to get in touch with the company and be sure to mention my name, Jamie Mazza. I promise they will take great care of you and you will love it. Thanks for tuning in, friends. So happy you're here. Did you enjoy this episode? If so, I would appreciate you taking a moment to please leave a 5-star review. Every review helps visibility with this episode to reach more people. And I am on a mission to help people learn alternate resources to support themselves in their healing journey on their road to health. So please take a moment to leave a review, leave a comment. I read every single one and I respond back. And of course, the most helpful thing you can do is to share this episode. If you found it helpful, if you found it entertaining, please share it on social media, send it to a friend, a loved one, someone you think could find this helpful. It means the absolute world to me. Thank you so much for being here. Thank you for listening, and I will see you soon.